At a very conservative estimate, we have about 77 million diabetics in India. As compared to the Western or the Eastern diabetic patients, our patients tend to develop complications at least a decade earlier. And by the time they are between the ages of 60 and 80, they have well developed complications. The American Diabetes Association has said that self monitoring of blood glucose is an important pillar of diabetes management, and it by itself reduces the HbA1c and improves glycemic control. Unfortunately, in India, the frequency of SMBG is very pathetic, and instead of being at least once a day, it is once in few weeks to once in few months. An international study comparing the practices across different countries found that patients in India had a drug adherence of between 30 to 50%, and their SMBG frequency was between 0.5 to 50%. So it shows you the very poor state of affairs in terms of diabetes management in our patients. What can we do about this? If we empower our patients and encourage them for self monitoring and being a part of their own management, they can improve their glycemic control. This would result in complications going down, as in retinopathy, nephropathy, stroke, myocardial infarction, or amputation of foot. The family is an integral support provider for our patients, and if they help out in deciding the frequency of self monitoring, the patient can definitely do better. We need to look at their schedule of SMPG based on their eating habits, their activity pattern, and accordingly decide upon the frequency and intensity of SMPG. The results would definitely be there in a very short time for all to see, and I'm sure the patient would have a healthier and fruitful life.